Hello, see you again. I'm Yun Shu from the Department of Microbiology and Immunology, Shantou University Medical College. In this chapter, we will discuss about rabies virus, which causes a classic genetic infection. Here are learning objectives. 1. Describe the biological properties of the rabies virus. 2. Describe the epidemiology, explain the pathogenesis and the clinical cause of rabies. 3. List the appropriate lab test for diagnosis and know how to manage, prevent, and control rabies viral infection. Let's start with a case. A bat was found in a 4-year-old boy's bedroom. It was there flying around all night. The child was not bitten nor had any contact with the bat. 4 weeks later, the boy developed a change in behavior, becoming irritable and agitated. Soon after, he became confused with uncontrollable thrashing about and inability to handle his secretions. He became comatose and eventually died from respiratory arrest. What did the child have? It was rabies. What kind of disease is rabies? Rabies is an acute and fatal infection of the central nervous system caused by rabies virus. Now, we will focus on the causative agent, rabies virus. What are the biological properties of the rabies virus? Rabies virus is the most important pathogen of the rabidoviruses. As you can see in the picture, the virions appear as bullet-shaped particles. The particles are surrounded by an envelope covered with protruding spikes. The spikes are composed of the viral glycoprotein, the attachment protein. It can bind to ACH receptor, NCAM, or other molecules in the peripheral nervous system and stimulate the host immune system to generate neutralizing antibodies. Inside the envelope is a ribonucleocapsid. The helical nucleocapsid is coiled symmetrically into a cylindrical structure, which encloses a single-stranded negative sense RNA genome. The genome encodes 5 proteins: nucleoprotein, phosphoprotein, large polymerase protein, matrix protein, and glycoprotein. The viral ribonucleoprotein core consists of the viral RNA encapsulated by M protein and associated with P and L protein. How does the rabies virus cause the disease? Let's turn to the pathogenesis of the rabies virus. Rabies infection is usually from the bite of a rabid animal. The pathogenesis of a rabies infection includes a sequence of the events. 1. The virus is inoculated by the bite. 2. Virus replicates in the muscle tissue. 3. Virus binds to ACH receptor and neuromuscular junction. 4. Virus travels along the axons in the peripheral nerves via fast retrograde transport. 5. Virus replicates in the local dorsal root ganglia. 6. Virus rapidly ascends along the spinal cord. 7. Viral infects the brain rapidly. The neurons in the infected area degenerate and lose their functions. 8. Virus spreads along the nerves to the eyes, salivary glands, skin, and other organs. The disease is an acute, fulminant, fatal encephalitis. A typical course is divided into 3 stages. 1. Incubation period. 2. Prodromal phase. 3. Neurologic phase. The incubation period in humans is typically 1 to 3 months, but may be as short as 2 days or as long as 1 year. The length of the incubation phase is determined by 1. The distance between the site of the bite and the central nervous system. 2. Size of the inoculum. 3. Age of the host. 4. Immune status of the host. 5. Viral strain involved. In this incubation period, the virus replicates in the muscle at the site of the bite. The patient has few or no symptoms. After weeks to months, the patient enters prodromal phase. And during the prodrome, lasting 2 to 10 days, the patient may show any of the following non-specific symptoms: fever, malaise, headache, pain, or numbness at the site of bite, fear of light, nausea, and vomiting, etc. What will happen next? Infection of the brain causes classic symptoms. Neurologic phase. Patients show signs of nervous system dysfunction such as anxiety, disorientation, hallucination, and bizarre behavior. Besides, general sympathetic overactivity is evident, including increased tears, sweat, and saliva production, and so on. Hydrophobia, fear of water, is the most characteristic symptom. Neurological phase is followed by convulsive seizures or coma and death. The major cause of death are neurologic complications and cardiorespiratory arrest. Rabies is fatal once clinical manifestations become apparent. Recovery and survival are extremely rare. Rabies infection does not elicit an antibody response until the late stage of the disease. Administration of antibody can stop disease progression only if given early enough. The table here summarizes the progression of rabies disease. We can review the 3-stage course. At each stage, there are various manifestations with different virus states and immunological response. In this section, we will draw your attention to the epidemiology. Rabies is the classic genetic infection transmitted from animals to humans. The disease is a widely distributed animal reservoir, as you can imagine. Wild animals and unvaccinated dogs and cats. In rural regions, many species of wildlife can serve as transmitters, and in urban areas, dogs are the main offenders. There are 2 principal sources of virus. First, major source, from saliva of an infected animal. The second, minor source, from aerosol in an enclosed environment containing rabid bats. How can an individual become infected? The routes can be from 1. The bite of the rabid animal. 2. Scratches, abrasions, or open wounds that come into contact with saliva or other infectious material from a rabid animal. 3. Inhalation of the aerosolized virus. 4. Corneal and organ transplants. Who are at the risk of rabies infection? 1. Veterinarians and animal handlers. 2. Persons bitten by a rabid animal. 3. Inhabitants of countries with no pet vaccination program. Generally speaking, a person with a history of an animal bite or presents with neurological symptoms establish the diagnosis of rabies. Laboratory tests are usually performed to confirm or exclude the diagnosis of an individual or animal. Initially, we should collect a proper specimen such as saliva, serum, cerebrospinal fluid, brain tissues, neck skin biopsy, autopsy material, and impression smear of the cornea. Then, several tests could be performed. 1. Detection of Negri bodies. Negri bodies, intracytoplasmic inclusions, can often be identified in infected cells. 2. Antigen and genome detection. Currently, antigen detection using DFA or genome detection using RT-PCR are relatively quick and sensitive methods for diagnosing rabies. 3. Antibody detection. Antibodies to rabies can be demonstrated, and sometimes viral isolation can be also performed. Clinical rabies is almost always fatal. How do we deal with rabies infection? Actually, once the symptoms have appeared, there's no treatment, only supportive care can be given. So, preventive measures are of paramount importance to stop the disease. 1. The first measure is local treatment of the wound. The wound should be washed immediately with soap and water or disinfectant. Human rabies immunoglobulin can be injected near the wound. 2. Subsequently, 4 immunizations with rabies vaccine are administered over 4 weeks. This might be the only hope for preventing overt clinical illness in the affected person. 3. For the people at high risk, pre-exposure prophylaxis with vaccine can reduce the odds of infection. Ultimately, effective control of rabies in domestic or wild animals is essential for prevention of human rabies. The control depends on management of stray and unwanted animals and a vaccination program for all dogs and cats. Lastly, let's return to the case. What did the child have? What is rabies? Hope you have got the answer. Thank you for your attention. See you soon.